Hi, I'm Gina Salazar. Welcome back to the Better Arizona Show. Do you suffer from chronic pain? Maybe you feel like you've tried everything from therapy and medications to maybe even back surgery, or possibly you've had back surgery and you feel like that's failed you too. Today we have Dr. Bigham here. He is with Novocur Pain Management Clinics, and you've got some really great alternatives for people who may be frustrated and feel like they've tried everything.
Yeah, we do. You know, a lot of people feel like they're really at the end of the road when they've had back surgery, or and oftentimes many back surgeries, and they're still having back pain. So what do we do? And we do have some solutions at Novocur for those people.
And tell me, who is a good patient for you?
Well, I would say anybody who is contemplating having back surgery first, and they haven't quite gotten there yet, and if they have not tried any interventional pain management procedures. A lot of people are familiar with acupuncture, massage, chiropractic care, or maybe even medication management, but they're really unfamiliar in a lot of cases with interventional pain procedures that can be quickly reduce their pain and get them to the point where maybe they're not thinking about surgery anymore. And then secondarily, we're thinking about the patients that have already had surgery or multiple surgeries and are still in pain. Those are other candidates for Novocur patients as well.
And then you have this procedure called a spinal cord stimulator.
Right.
Tell us a little more about that.
It's called Spinal Cord Implant Stimulator, and basically this would be kind of a last resort for people that have had multiple surgeries. They've been unable to control their pain in any other fashion, and what we do is we can run some tiny little wires, we call them electrodes, up into the epidural space, which is normally where we would inject medication into, but instead of medication, we're running some leads. They have electrodes on them, and we're able to stimulate the backside of the spinal cord in such a manner that we can block the reception of pain in whatever part of the body they're experiencing the pain. So let's say they have low back pain and left leg sciatic pain. We're able to tweak those electrodes, the stimulation of those electrodes, and how they are bombarding the spinal cord until we match that pain exactly. And in such a way we can replace the pain with more of a pleasant sensation of vibration or a tingling sensation, which is much more palliative than excruciating pain for most of these people.
Oh yeah, like you were saying, a lot of these people are disabled, they're maybe out of work, and I'm sure by the time they come to you, they're pretty emotionally frustrated and just down. Yeah,
a lot of people think, well, I'm going to do the surgery, and I've been putting that off for years, but this is going to be the solution. And then when it's not the solution, it is a real psychological downer for those people when they have such great expectations. And that's one of the problems that I think a lot of people have, is they haven't had that conversation with their surgeon in an in-depth enough manner where they really understand what the potential outcomes are. I tell people, never even contemplate surgery unless there's a real neurological deficit in the low back when we're talking about legs. So that would be weakness in the legs, numbness and tingling, where we see maybe perhaps a loss of size of the leg musculature. If there's not that type of neurological symptoms present, you shouldn't even be considering having surgery, because that is where surgery is the most successful, is in eliminating those type of leg neurological symptoms in the lower back.
That's great. How can people get a hold of you?
Well, they can go to our website. We have a lot of great information on our website. That's novocur.com, Novocur.com, no E on the end. Or they can call us at 480-855-6686, and they can schedule a consultation. They always will meet with our doctor. They're never going to meet with an intermediary, a nurse practitioner, a PA, and not that those practitioners aren't effective, but for these types of things, you need to meet with the person who's going to be treating you.
All right. Well, Dr. Bigham, thank you so much for being here today.
Okay. Thank you. Appreciate it.
The Better Arizona Show will be right back.